Have you ever wondered why some men seem to struggle with premature ejaculation? It's a question that's often asked but seldom understood. Premature ejaculation, or the inability to control ejaculation during sexual activity, is a common issue experienced by many men. It's not something that only happens to a few. In fact, it's a widespread phenomenon. The reasons behind premature ejaculation can be varied. It may be due to psychological factors such as stress, anxiety, or physical factors like hormonal imbalances or certain medical conditions. It's crucial to remember that these are normal and often temporary situations. There's no need to feel embarrassed or alone. This common problem affects men from all walks of life. But despite its prevalence, it remains a topic shrouded in mystery and often unnecessary shame. Breaking down this barrier of silence is the first step towards understanding and overcoming this issue. Now that we understand what premature ejaculation is, let's delve into how to overcome it. Did you know that your mind plays a significant role in premature ejaculation? That's right. It's not all about physical control. Your mental state has a significant impact as well. Let's dive a little deeper. The mind is a complex machine, and it can either be your greatest ally or your worst enemy when it comes to controlling premature ejaculation. Psychological factors such as stress, anxiety, and negative thought patterns can trigger an early response. You might be wondering, how does this happen? Well, when you're stressed or anxious, your body can mistakenly interpret these feelings as a signal to speed up ejaculation. And it's not just about the here and now. Past sexual experiences and the way they've conditioned your mind can also influence your control over ejaculation. If you've had experiences that led to premature ejaculation, your mind might be conditioned to repeat that pattern. But don't worry, there's a silver lining. The same way your mind has been conditioned to react a certain way, it can be reconditioned to respond differently. This is where mental relaxation and positive visualization come in. By training your mind to remain calm and visualize a different outcome, you can help change the pattern. So how can you achieve this mental relaxation and positive visualization? Techniques such as meditation and mindful breathing can be incredibly helpful. Meditation helps you focus on the present moment, reducing anxiety and promoting a sense of calm. Mindful breathing, on the other hand, is a technique where you focus on your breath, slowing it down, and in turn, helping to control your arousal and anxiety levels. Remember, these aren't quick fixes. They require practice and consistency. But with time, you'll notice a change not just in your control over ejaculation, but in your overall mental well-being. So, there you have it. Your mind, once a foe, can be trained to become your greatest ally in this journey. Remember, your mind is a powerful tool. Train it well, and you're halfway to overcoming premature ejaculation. Besides mental conditioning, certain physical techniques can help delay ejaculation. One such technique is known as the start-stop method. This involves stimulating the penis and stopping before you feel like you are about to ejaculate. You stop the stimulation for 30 to 60 seconds, and then start it again once you feel that you're no longer on the brink of climaxing. This process is repeated 3 to 4 times before you decide to let yourself ejaculate. The idea behind the start-stop technique is to get you more acquainted with your own sexual response, so that during sex you can delay your ejaculation on command. It's all about understanding when you're approaching the point of no return and learning how to dial things back a bit. The second technique is called the squeeze method. This technique requires the help of your partner. Like the start-stop method, you start stimulating your penis and stop when you feel like you are about to ejaculate. At this point, you or your partner squeezes the base of your penis for about 30 seconds. The squeeze should be firm but not painful. After the squeeze is released, wait for about 30 seconds, then go back to foreplay. The squeeze method works by reducing your sexual tension, which represses the ejaculatory response and thus helps you last longer. Think of it as a kind of reset button to help you gain more control. Both of these methods require practice and patience. You may not notice any significant changes immediately, but don't let that discourage you. It's important to keep in mind that mastering these techniques takes time, and it's okay to have setbacks. The goal is to gradually build up your tolerance and improve your sexual stamina over time. Remember, there's no rush. Take your time, be patient, and most importantly, communicate with your partner. These techniques are not just about delaying ejaculation, but also about building a stronger, more intimate bond with your partner. With consistent practice, these techniques can significantly improve your control over ejaculation. Sometimes, despite all efforts, professional help might be needed, and that's okay. Let's face it, there's no shame in seeking an expert's opinion when dealing with something as sensitive as premature ejaculation. It's important to remember that everyone's body is unique and what works for one person may not work for another. When should you consider professional help? If your attempts at self-help aren't producing the desired results, or if the problem is causing significant distress, it might be time to consult a healthcare professional. This could be a general practitioner, a urologist, or a sexual health therapist. They can provide a comprehensive evaluation and guide you through the next steps. So what kind of help is available? Therapy is one option. Cognitive behavioral therapy, for instance, can be very effective. This approach helps you identify and change negative thought patterns and behaviors that may be contributing to premature ejaculation. It can also help you manage stress and anxiety, which are often linked to this condition. Another option is medication. Certain antidepressants and topical anesthetics have been found to delay ejaculation. However, these should only be used under the supervision of a healthcare provider, as they can have side effects. Openness and communication are key in this journey. It's important to talk openly with your partner about what you're going through. This can help alleviate any associated stress and create a supportive environment. Also, don't hesitate to ask your healthcare provider any questions you may have. No question is too small or too embarrassing. In conclusion, it's important to remember that overcoming premature ejaculation is not a one-size-fits-all process. It can take time and patience, and may require different methods for different individuals. But with determination and the right guidance, it's a journey you can successfully undertake. Remember, overcoming premature ejaculation is a journey. It requires patience, practice, and sometimes professional help. But with determination, it's a journey you can successfully undertake.